Hi, my name's Erica and I'm a student from the University of St. Francis, and I'm going to be performing a newborn assessment on your baby today. I'm going to go ahead and check his ID bands. Should be one here on his wrist, and we got here one on the foot. Okay. And then I'm going to go ahead and take his vital signs. I'm going to take his temperature here in the axillary. Should be about 97.7 to 99. And I'm also going to feel for respirations at the same time. And it should be about 30 to 60. Okay. Go ahead and listen to his pulse. And I'm going to listen to the apical pulse for a minute. And this should be about 100 to 160 beats per minute. I'm also going to listen to his heart sounds and his lung sounds. And then while I'm down here, I'm also going to listen to his bowels. Everything sounds good. I'm going to go ahead and assess his head. I'm going to feel in the fontanelles. It doesn't seem like there's any bulging or sunken in, so that's good. And the sutures are present. And there's no presence of caput succedaneum or cephalohematoma. And I don't see any scratching or bruising. I'm going to go ahead and look at his eyes and make sure that his eyes aren't too wide apart with the bridge of his nose. And there's no discharge coming from his eyes, so that's good. And his eyes are in line with his ears, so if the ears are lower, that could be a sign of Down syndrome. I'm going to check his ears. I'm going to check the cartilage. So I'm going to fold down towards his earlobe. And I'm also going to fold down or back towards his face. And then if it recoils fast, that's good. That's what we're looking for. I'm going to check the nose patency. Okay, and I'm going to go ahead and put gloves on. Alrighty, and I'm going to check for rooting. I'm going to check for sucking. And I'm going to go ahead and palpate his neck. Look for masses. I don't feel any masses. And I'm also going to rotate his head and check for his rotation. Okay. I'm going to palpate his clavicles because these are a lot of times easily broken during birth, but these feel good. Go ahead and look at his skin. Skin looks pretty good. I don't see any peeling or rashes. The vernix isn't present, and the lanugo should only be present really on the back or the butt, and so I don't see any on his chest or abdomen. And his color is pink, so that's good. I don't see any bruising. I'm going to check for jaundice. So I'm going to palpate the forehead, chest, abdomen, the thighs, and then I'm going to look at his eyes for yellowing as well. Also, during this, I could check for respiratory distress. If he was in distress, I would see signs of flaring, retractions, grunting, seesaw breathing, or apnea. Also, while I've got his shirt open, I'm going to look at his abdomen. It's soft, round, and it's not but it's not distended, so his abdomen looks good. Okay, I'm going to go ahead and put gloves on. And then I'm going to look at his cord. It's drying, so that's what we want to see. And if he's over 24 hours old, the clamp should be off. So his is off, so that's good. And I'm going to check his genitals. he's a boy and he's not circumcised, so I'm going to pull back the foreskin on the penis, and the meatus is center and at the tip, so that's what we want to see. And we have some rugae, but we don't have too much. If he was circumcised, I would check the incision and check for excess bleeding. If it was a girl, I would make sure that his or her labia majora cover the clitoris as well as the labia minora. I'm going to check the tone on his arms. So I'm going to hold the arm up, and then when I pull it down, he's going to put resistance on my hand, and then I'll let go, and the baby should move the arm back up towards its face. And then I'm going to look at his hands. He has creases, so if there's only one crease, this would be a sign of Down syndrome. Checking, he's got 5 fingers, so I'm going to check for that on both hands. Okay. And then I'm going to look at his feet. He's got creases on his feet as well as 5 toes on each foot. And then I'm going to do the check for Babinski's. I'm going to take some kind of object, and I'm going to go from the heel, scrape towards the toes, and the toes should fan out. Let's check for the Babinski's. And then I'm going to go ahead and flip him over. I'm going to palpate his spine. Make sure the spine is symmetrical. And then we're looking for dimples, and I'm going to look at the gluteal cleft. If there's a tuft of hair, that is sometimes a sign of Down syndrome. So we don't have any hair down there. And then I'm going to go ahead and look at his hips as well. The gluteal smile are even, so his hips should be even as well. Alrighty, and then I'm going to clap my hands. And this is going to test the moral reflex, and he should bring his arm to his side first, and then bring it up, and then make a kind of C with his hand. That's what we're looking for with the moral reflex. He was pretty calm throughout the assessment, a little bit of crying, but with the crying I didn't hear any hoarseness or crackles, so I don't think he has any signs of excess fluid or anything. When was the last time that he had a bowel movement? And when was the last time he voided? Okay. When is he due to feed next? Okay, we're just checking to see when all this is due to make sure he's staying on schedule. Everything went pretty well with this assessment. We'll be back to check on you in an hour. Is there any questions you have for me right now? Alrighty, your baby looks nice and healthy. Thank you for letting me assess him.